Well, welcome to the mental health panel. I hope we get a lot out of this. I think this is something that's really relevant to all of us today. And we've got some really good speakers, and maybe we can all learn some pearls and help ourselves out. We have 3 speakers today, and we have Sue Aberholden, MPH. She's the Executive Director of the National Alliance on Mental Health. Her passion is the mental health mission stems from having family members who also live with depression and anxiety. There's Shannon Mulhilville, if I said that right. She's an MA, CFRE. She's Executive Director of Mental Health Minnesota. She holds a master's degree in counseling psychology from St. Mary's University of Minnesota and has served as a volunteer counselor for the walk-in counseling clinic and crisis in action. We also have Susan Fishman. She's a licensed social worker, LCSW, who has been facilitating the Myositis support group at the Hospital for Special Surgery in New York City since 2008. She also practices privately with a specialty in chronic illness. I think that they'll be able to help us, give us some pointers, and I'll turn the table over to them.
Well, thank you so much for inviting us here today. We're going to just take a few minutes to kind of go over some key issues. The first one I'm going to do is just talk a little bit about depression. So depression is actually very common. It's the second most common mental illness. Anxiety is first, but it does affect about 7% of the population. It doesn't matter who you are. It doesn't matter your age. It doesn't matter your religion, your race, your culture, your political party. It doesn't matter. It impacts everybody. It's a little bit more common among women than men, and I think that can relate to hormones and things like that. And then there are risk factors for developing depression. One is just family history. So if someone else in your family has depression, more likely that you will. Also, if you've lost a family member to suicide, you also may be more likely to develop depression. And the other issue, of course, is chronic illnesses. People often have depression along with a chronic illness. So some of the symptoms are really pretty basic. A big one is just that you don't have a lot of joy in life. There's nothing that really interests you, that makes you happy. Okay, really, I think it's hard with the room next door. It can actually make it difficult to make decisions because your brain feels kind of cloudy. And so it's kind of like, I don't know if I should do this or if I should do that. It can actually, because it's hard to concentrate, it might be hard to read a book, even to watch a TV show, that kind of thing. We also see that people just kind of feel hopeless, and I think that can also go along, frankly, I have family members who have depression and a chronic illness, and it's just kind of like, okay, nothing's really going my way, and I don't feel like I'm going to get any better. Another thing is sleep. So we know how important sleep is to our mental health, but because of depression and also because of chronic illnesses, you may not get a good night's sleep. You may be waking up at different hours, really not getting the sleep that you need. And that means that you're actually tired and exhausted all the time, which also doesn't help. And the other thing is food. So either eating too much or too little, but also not getting a lot of pleasure out of eating. Risk factors when you have a chronic illness and depression, a lot of it is because you're getting those changes in the brain. There can be, anxiety and stress can trigger symptoms of depression, and when you have a chronic illness, you can experience a lot of anxiety about, how this illness is going to progress. We know that people with depression and another medical illness tend to have more severe symptoms of both, and so it really is important that you address both conditions when you move forward with it. Some other changes that we can see with depression, and there's a lot more research going on, is there's increased inflammation. And so you kind of think about how that relates. Changes in the control of your heart rate and your blood circulation. Abnormalities in stress hormones, and then even metabolic changes can happen, especially, for example, for people with diabetes. So what happens when the two come together is that you can actually, with depression, be too tired to manage your symptoms of your other chronic illness. it becomes kind of overwhelming in terms of the different things that you have to do. Making it hard to concentrate. Did I take that medication today or didn't I? And so that can all then, kind of get into that vicious cycle. Increased irritability. And so that makes it harder for people to help you, right? If you're irritable all the time, your caregiver might be like, okay, I'm just gonna take a break here and move on. And then the lack of sleep can actually exacerbate the symptoms of the chronic illness. Because again, we know how important sleep is to our overall mental health and health. And when depression interrupts your sleep, you're not getting the sleep that you need to have the energy you need in order to address your other illness. And then it's, again, hard to figure out which one is causing the fatigue, right? Is it the depression? Is it the chronic illness? But no matter what it is, having fatigue is not going to lead to you being healthy. A big thing is that I want to stress is that you are not alone. And I think I've been with NAMI for 18 years and have had, again, family members who live with serious depression. And isolation is a huge issue. And that's just not a good thing, right? When people are depressed, they don't have the energy to actually reach out. I had a woman who I talked to had lived with depression for a while, and she said, she had friends who would text her and say, come on out, and she was just too exhausted to even respond. But she had one friend that just never gave up and kept texting her still every day until finally she felt like she could respond. And she really appreciated the fact that her friend didn't give up on her. But she said, I was just too tired to do it. But she also then became so isolated, right? Which is not a good thing. We think it's important that families also educate themselves. You get a lot of bad advice when you're a family member who has a loved one with a mental illness. Tell them to buck up, tell them to try harder, use tough love, all the things that don't work at all for any illness, they still kind of lump those in with mental illnesses. And then I think another thing that's really important, there's kind of, bad advice out there too, is that if you just take this one pill for an antidepressant, you're gonna be better. And it's more than that. There is not one thing that you can do. It has to be a multitude of things. So when you're looking at just taking medication and antidepressant, there's more things that you need to do too, including things like therapy, nutrition, all of those kinds of things. I just wanted to give you a couple of resources. There's a NAMI in every state, but there's a national NAMI helpline. So if you're trying to figure out so what are the different treatments for depression? What are some things that I can do? What are some of the symptoms? You can call there. Many states actually now have mobile mental health crisis teams. So if you're at a point where you're actually, frankly, feeling suicidal or feeling really down, know that that's someone that can call. You can call, and actually they often go to people's homes or where they are. There's a national suicide text line. I think the text line is very important because people under the age of 40 do not make phone calls. They text. And if you're worried about actually just you don't want someone to overhear you, you can text. So 741-741. You can text your state MN or whatever your initials are for your state. You can text NAMI and they respond. And I just actually ran into someone yesterday whose daughter had used the text line and said that it truly saved her. She was feeling suicidal and it really helped her get through that tough period. And then last, we have the National Suicide Helpline. Again, this is wherever you are in the country. It's 1-800-273-TALK. You will be hooked up to someone who can kind of walk you through and talk to you and provide that support that you need at that particular moment in time.
Okay, my name is Shanna Mulvihill, and I'm the Executive Director at Mental Health Minnesota. We are an affiliate of Mental Health America. And so one of the things I wanted to talk about today was Mental Health America's approach to mental health. And that is, that's really about what we call a before stage 4 approach to mental health. And so what does that mean? That means that when we look at a lot of physical health conditions, whether it's diabetes or cancer or heart disease or many other conditions, we don't wait until stage 4 to treat, right? We pay attention to symptoms that are showing up. We go to the doctor. Doctors are paying attention to those symptoms and working to treat them, to provide interventions, and not wait until things get really, really bad. Unfortunately, largely, that's not the way mental health and mental illness is treated in our country and around the world. And so our real goal with Mental Health America is to start to change that. And so that is first about early recognition of symptoms. Sue just noted a number of symptoms for depression in particular, but it's about paying attention to things being different than they were before, and noticing those things about yourself, noticing them about someone you care about, and then taking some action. And one of those actions can be doing a screening. We have a screening program on the Mental Health America website that's free, it's anonymous, it's confidential. You can go through and answer some questions based on some things that you're feeling for a number of very common mental health conditions and see what happens. See whether you screen positive or not. If you do, there are a list of resources that will be based on your location that can help you seek help. Because it's about recognizing those symptoms early. It's also about paying attention to them and doing a screening to know if you should take some action. Because it's kind of it's a tough line. I think about things, particularly like depression and anxiety, as kind of a continuum, right? We all fall somewhere along it at any given point, and it's kind of knowing when is that point for you when you need to reach out for help. But you can't just manage how you're feeling anymore, and you need some help or some support. So the final thing is about getting that help. And so it's reaching out to places like the helplines that are available. It's reaching out for support. And one of those pieces I think is really important is warm lines. And Sue noted that in her PowerPoint. We run a warm line, Mental Health Minnesota does here in our state. And so warm lines are about peer support, and they're about just getting support that is not at crisis level. Because we want to go upstream and not wait for things to get so bad that people need a crisis team or 911. But that we can really think about acting way before that happens. And so to do that, then we provide a warm line service here in Minnesota. The reason I wanted to mention that is I think there's a number of things. There are a couple of things that stand out to me that I think are applicable here today. One of them is about 75% of those who call our warm line are really calling to try to reduce their loneliness and social isolation. Sue mentioned isolation as being a big factor. I think it's just an enormous factor in overall health and wellness. And we really need to start addressing it both in the mental health world but also in the physical health world as well. So roughly, like I said, roughly 3/4 of those who call our warm line are facing a lot of loneliness and social isolation. A lot of those people are also dealing with a chronic health condition and potentially some long-term or chronic pain. We hear that a lot because it tends to limit their ability to socialize with others. And so being able to talk about that and reach out to others is so important. I actually saw a study recently that said that chronic social isolation does the same damage to your physical health as smoking 15 cigarettes a day. It seemed really shocking to me, but I kind of get it because I think we can see, even if you're just alone for a few days, you start to feel that impact, right, on your energy, on your ability to connect with other people, on how you're feeling. Imagine that just happening over and over and over time. And so it's really important to connect however possible. That may be through services like our warm lines or warm lines in your state. It might also be about finding other ways to connect or online support groups. Or I think technology has provided a lot of new opportunities for people, even if they are kind of stuck in their own homes, to be able to seek help. So those are the things I wanted to note, and then I'll look forward to questions.
I'm going to speak about the emotional challenges and strategies for coping.
Better really put it right up to your mouth.
Is this better?
Yeah.
Okay.
Yes.
I'm going to talk about the emotional challenges.
None of us back here can see you all. I don't know if there's any way to help that.
I'll stand. Strategies for coping with depression when living with myositis. Yes.
I don't think your microphone is working or you need to have.
You have to really put it right up to your mouth.
Is this better? There we go. Okay, sorry, thank you. So first, what are some of the factors that may increase the chances of experiencing depression in myositis? Research shows that people with chronic illness are 2 to 3 times more likely to experience depression than those without a chronic illness. Having a chronic illness can cause feelings of helplessness, hopelessness, isolation, as we've heard, fatigue, and the inability to do the things that once brought you joy. There can be a sense of loss of control over one's life. These are some of the same feelings that can cause depression. So what are some of the factors that may, in myositis, that may contribute to these feelings and susceptibility to depression? First, there's the overall general sense of loss of many things that we will now go into, and also anger that your body has betrayed you. So here are some of the factors that pertain to people with myositis. There are the physical limitations, the pain, the reduced range of motion, the weakness and the fatigue, medication side effects, which all lead to the inability to do things that you once enjoyed. There's the fear of falling. People with IBM are very aware of this, that you can fall without any warning. You just go down, and getting up from a fall is very difficult because there's limited upper body strength. The difficulty swallowing, which can then result in the fear of choking, which may prevent you from eating foods that you once enjoyed. Myositis is a rare and invisible illness. So you hear things all the time like, well, you don't look sick or you look fine. The insecurity of medical care, meaning that it can be very difficult to be diagnosed and find doctors who understand myositis, and we've heard that throughout our sessions here. And also communication among doctors can be very poor. In other words, managing your medical team is difficult. Relationships can be affected. Partner intimacy, you're not feeling well. You're, again, angry about the toll that this disease has taken on you and your body. You're asking, and so intimacy kind of can go out the window. You're asking, who am I now? You've lost some of your sense of identity. What was your role in the family? Were you a parent? Are you deciding to have children, and what would that look like? Would you be able to take care of your children? Have you been a mother, a father, a husband, a wife? And how has that changed, both for you and for your partner and family? Planning activities may be challenging, and you may need to cancel at the last moment because you're just feeling too tired and not up to it. And many people don't understand this. So that can lead to, again, more isolation because you may decide, well, I'm just not going to even try to go out or make plans. Education and career may affect people who are younger in terms of deciding what they want to do in terms of education and higher education and what they'll major in. For employment, will your current employer understand the limitations you might have and offer you access and flexibility for your care? So I certainly haven't listed all of the things that might impact people with myositis that can lead to depression. But I think it's important to try to remember that myositis does not have to define who you are. Your life has been altered for sure after diagnosis, but try to remember who you are as a person. What are your values and what are your beliefs? So some things that you can do: speak to those who you trust about how you're feeling. Learn to communicate. People aren't mind readers, and they can't understand what they don't see. Work toward adapting and accepting changes as they occur. So once we start to accept our limitations and the changes, we can use things to help adapt to those changes, whether it's equipment, whether it's a change of career, change of other choices. It's all very important for you to be able to do that. Look for ways to problem solve. Maybe you need more equipment to get things done. Maybe you need to take more time to get things done. So learning to plan in advance is important. Try to avoid all or nothing thinking, otherwise known as catastrophizing. And by this, what we mean is that it's very common to say, I'm just too sick to do this, or I'm always going to feel this way. And it might be more helpful to say, well, you know, I was feeling a little bit better yesterday, and I might feel a little bit better today, tomorrow. But today, I'm just going to try to take it easy and try to just listen to my body and do things according to what I'm able to do or not. Another thing that might be very helpful is empowering yourself through advocacy, advocating with your medical team, advocating with insurance companies, for people who don't understand about myositis. It's important to educate others, and we've heard that also throughout our sessions, that you can be your own best advocate. To the extent that you might be able, helping others is a great way to kind of get out of yourselves. So if you can help others, that can be helpful to you as well. Practice kindness and compassion, both for yourself and for others. Religious and spiritual affiliations, we know, can be very powerful in helping people manage with feelings of being alone and help you feel more connected. Other ways to feel connected, especially for people with myositis, which is a rare illness, you have a community and other support groups, which you can get through TMA. You can get names of support groups, and there are also many that are available online. Mindfulness, very important to try to help calm down those feelings of stress, to slow down your mind. There are apps available on the phone, and many people will say, I can't meditate, I can't concentrate, my mind wanders. You can actually do this in as little as 10 minutes a day, and you learn that it's okay for your mind to wander, but that it brings you back and helps guide and focus you. Any type of movement that you can do would be helpful. Gentle yoga, chair yoga, even if you're in a wheelchair, moving your joints. There are many videos available, but of course, always speak with your doctor before engaging in any exercise. It's important to know, as we've mentioned already, that depression is treatable, and that it's not a necessary consequence of chronic illness. However, when it is, it's important to treat each separately. And I would refer that again back to the recommendations made by my fellow panelists. So in an emotional crisis where you feel you might be in harm of hurting yourself, in addition to the recommendations that were made here, I would also say that you can go to your nearest emergency room. Speak with your doctor. Oh, I'm sorry, this is about getting outside help. I forgot to mention that. So sometimes we can't do this all alone. And so what I'm mentioning here are those things we can do outside of ourselves to try to get help. If you speak with your doctor or healthcare professionals to find out where there are social service agencies, community mental health centers, licensed clinical professionals who can help you with depression. And maybe if antidepressant medication is needed, to consult with a psychiatrist or with your religious or spiritual leader for some guidance. I'm now turning to some of the concerns of our care partners. In doing so, I would like to first acknowledge how we arrived at this term care partner as opposed to caregiver. This was popularized by a woman named Phyllis Lowinger, who's also a social worker, whose husband had IBM, and who was a longtime member of TMA and the myositis support group at Hospital for Special Surgery. And it was her idea that when someone is diagnosed with myositis, you don't stop being a partner in your care, as a husband, as a spouse, and that you still have responsibilities and you can't just give up. If you were the person who paid the bills, that's something that you might be expected to continue doing. And it's important, actually, in terms of this care partner, caregiver issue. Of course, when someone's at a younger age, either a child or an adolescent, there's more caregiving required and care partnering. But even within this, it's possible to allow people to make choices where it's appropriate so that one can regain some sense of control over their lives and what's happened to them. So I decided to go straight to the source and ask some of our care partners what their concerns were. And some of them included worry about finances. How will I be able to manage if my partner can't work? Sometimes I feel I have no right to complain or consider my own mental health needs. I also have health issues, and I wonder how long I'll be able to help my partner. And sometimes I'm just too exhausted to provide the help that is needed. So it's normal, as it is for people with myositis, it's normal to grieve the loss of the relationship you once knew. And this is really important, to allow yourself to feel what you feel, because it's real. Acknowledge your feelings and maintain ongoing communication. And you know, when you're now faced with such a life-altering event, that many and conflicting feelings, so many of those feelings you may be keeping bottled up or holding them in, and they're going to boil over into something that could be kind of hurtful and destructive. So sometimes it's important to get outside help, either individually or with your partner, in order to know how to communicate in such a way that is more effective and less hurtful. And another example of that would be, for instance, you know, if you need doctor's appointments or help getting to physical therapy or other medical treatments, discuss with each other what days work best for you. I'm available this day, but not that day. And of course, this is all within the confines of appointments that can be made, you know, when doctors are available, when your healthcare professionals might be available. Take time for yourself to do activities that you enjoy. This was really brought out by one of our members with IBM, who said that she was thrilled when she learned that her husband had joined certain clubs, and that it made her feel good to know that he could get out and do things that he enjoyed. Find workarounds rather than saying, I can't get this done. Just like when we're catastrophizing and we're saying, I can't do this. So learn to do, what can you do? So maybe you can't garden outdoors anymore. You can't bend down, but maybe you can become an indoor gardener. Maybe you can learn how to, you know, you were once an avid skier, or you were an avid rower or cyclist. Maybe you can learn how to adapt to do something else that you might enjoy. And as another member recently said to me, if you can't do what you love, learn to love what you do, which I thought put it pretty well. So we know that having a chronic illness means that many days are filled with medical appointments, medical treatments, how to get things done. So it's important to try to find those activities that you can do that are enjoyable together. That maybe you can still take a walk together in a park, but maybe you need to shorten that walk or use some kind of a device to help you out. Also, in planning for the future, you need to think about what those needs might be, whether it's your residence, whether it's finances, and you might want to speak with a financial planner. This is also a time for you to gather supports, not to stay alone. Find family, find friends, your religious community if they're available, or paid help if that's possible. Also, remember, therapy, counseling can be very effective for yourself or for you and your partner. Be realistic about what you can and cannot do. Here's a list of some readings. 5 of these summaries were presented to the Myositis Support Group at Hospital for Special Surgery. These were presentations given by patients. And so these are summaries of those presentations. Another article from the New York Times on how to disclose a disability to your employer and whether in fact you should do that. And our very own Linda Covert had recently written an article in a journal describing the challenges that people who are younger with myositis may face. So I hope that we've been able to help identify some of the factors that may increase the chances for depression in myositis and chronic illness in general. Thank you.
We can answer some questions if you have questions. This is all also being recorded. You can find a lot of these resources will be posted on the website as well. For our first question, how can people tell the difference between depression and just adjusting to changes due to their chronic illnesses?
Well, one thing we always talk about is the length of time and intensity. So, certainly, a couple of days, even a week or two, but then if it continues and if it's actually interfering with your ability to do some of your everyday activities, then I would say you need to be more concerned.
I think I would just add that that's what the screening tools are all about on the Mental Health America website is when it has gone a while, just like if you had a cold for a while and suddenly you're wondering, oh, maybe I have a sinus infection, maybe it's something worse than I'm just not getting over, then it might be time to do a checkup. And a screening is a very quick and easy and very painless way to do that.
Yeah, so I would agree, and I would also add, so I would put an emphasis on whether there's been a change in your mood from your previous mood that's lasted at least 2 weeks, and that you're feeling these symptoms, you're feeling these feelings most of the day, every day of that 2-week period. I think that's, that's kind of key.
Myositis we do have support groups, usually by regions, but to your knowledge, are there actually generalized support groups around the country for like major hospitals and things like that that are for people going through chronic illnesses, and to have that type of group session where we can sit down and talk and
So, just relating to myositis support groups, we know that, yes, they're scattered throughout the country. It's sometimes hard for people to get to those groups because they live a distance. I think TMA, for one, is trying to incorporate Zoom so that there are there's online accessibility to join in. So there would be, that support from people who are dealing with issues just like yours. And there's also outside, we have a table for myositis support and understanding, which is all online and which is geared to all different types of myositis. And I think that can be a helpful resource as well. So just check out their table.
And I'll just add that there are, NAMI across the country has groups both for family members, so we do it separately, and for people with any type of mental illness, although depression and bipolar disorder are some of the largest ones. And some of us in Minnesota, we actually have a web-based support group, so you can join online or through your support group or through your smartphone, and you don't have to worry about going anywhere to get that support that you need. So I think kind of depending on which symptoms are causing you the most difficulty is where you should go.
Hi, I was wondering if you could talk about something that's kind of unique to IBM. And because IBM is a never-ending degenerative process without stopping, it's a continual series of losses where you lose one function, and later you may go through the stages of grief and come to acceptance. Well, another loss is about to happen, and then another loss and another loss. So it kind of feels to many of us like it's a never-ending stage, a never-ending process of grief. Can you talk about how to adapt that and how to deal with that?
Well, I think that it's a real challenge, and I don't want to minimize what that is like to go through those changes and to anticipate further decline. But I think, again, it does go back to adapting to kind of accepting what it is that's happening to you, and maybe because you know things will happen, to plan ahead. We've had people in our group say, don't wait until you need that wheelchair. You know, think about where you might be in 6 months from now. It all depends on how you're doing. We all know that it's individualized how everyone progresses with disease, but to be emotionally prepared and to not be surprised by it can help you feel more physically prepared for it. So you may not need that wheelchair right away, and you may not need that rollator right away, and you may be walking with a cane or with a cane or other assistive devices, but it's good to have that available to you so when that day comes, it's there for you. I hope that helps answer the question.
You may have mentioned how to contact a warm line, what that is, but I missed it. Can you re-explain it?
I can. There are warm lines in existence all over the country. There are some that are national, there are some that are statewide, like mine is. And so there's actually a website at warmlines.org where you can find something local.
Thank you.
You bet.
Can you repeat that? I'm not sure what word you're saying, if you're saying worm or warm.
Yes, okay, it's warm, like W-A-R-M. Like as opposed to a hotline, a warm line. I should really lead with that.
We generally use hotlines if you're in crisis and need help right away. The warm lines are, well, I'm just not quite feeling right. I want to reach out to somebody. It's not quite so emergency, quite so urgent.
Yeah, I was just going to ask, have they found that antidepressants or anti-anxiety meds will interfere with inclusion body? Like, will it kind of mess or exacerbate your health issues if you're adding another medication? I mean, most of us are not much, but I'm just wondering, because I know there's such a multitude of side effects to these that I almost hate to start with anything.
Well, I think that's a really good point, because very often primary care physicians will prescribe antidepressant medication, but in a situation where you're taking multiple medications, you really need the experience of a trained psychiatrist to know what those interactions might be. And I think that's the way that I would go with it.
I just want to add too that I think while medication is very effective for many people, there are a lot of different ways to treat mental health conditions as well, whether it's seeing a therapist or a psychologist, joining a support group, talking with people on warm lines, peer support. There's a lot of opportunities to get help in a lot of different ways. And so I think it's important to complement any medication that you may be getting with some of those other things that can be helpful for you long term.
Let me add something to that too. There is also tests that they can do now to match you to your antidepressant. Instead of trial and error, they have tests that they draw your blood that they can match it to. This one's not going to work. This one may work, may not work. This one would be a better choice. So it's not so trial and error nowadays also.
And even DNA swabbing. Exactly.
Yes, and DNA swabbing can teach that also.
I am a care partner, and my husband has IBM, and I myself, I see a therapist for help. And my husband, he is on medication for depression and anxiety, which he had because he was in and out of the hospital for being sick. But I do want to encourage him to go to therapy, but he doesn't want to go. So how do you encourage somebody to go to therapy when you know for sure it would make a difference, unless it's just me trying to mind read and me just trying to push my values and my beliefs onto him, but yet I see that he's isolating, yet I see he's withdrawn, and yet, you know, it's very hard. So I don't know if you have any advice on how to get someone that's sick and encourage them to maybe seek professional counseling if you think they need it.
So having been in a similar situation, I think it's important to, you know, we're partners in this, right? And there are things that you can do to get better. And so before you just say no to therapy, just, you know, outright, say it's something that I want you to try. You know, it can make our relationship better. We know that if you start really thinking kind of those negative thoughts, that you start feeling worse or your anxiety starts increasing. And through therapy, you can learn some tools to kind of turn that around. And so I just kind of pushed it as not an ultimatum, but just saying we have to work together on this. And I really want you to try this to see if it does help. If it doesn't help you at all, fine, we can stop, but you have to at least try this for me.
And I appreciate too that you mentioned about how there is some grieving as a care partner. There's grieving that he goes through, right, physically and emotionally, and as a care partner there is grieving in terms of your intimacy, in terms of the direction your relationship is taking, and also the fear of the next step could be assisted living, and that's kind of where we're at now. I mean, we kind of briefly talk about it, and it's very scary to me because I don't like the idea of him not living with me. And I hope it doesn't happen, but I have to also not put my head in the sand. So that's kind of where we're at right now. Thank you.
I have two quick things. I'm one of the support people. My wife and I, Bill Madden, and I already talked about the Planned Parenthood book, you know, that I mentioned earlier. But for people who are still feeling athletic and losing their strength a little bit, they might consider pickleball instead of tennis. Because if you don't know about pickleball, then you can still get around and move a little bit. It's a fantastic thing for people in retirement communities and people who can't move as well. So if you don't know about pickleball and you still want to get athletic, you might try that. Pickleball, P-I-C-K-L-E-B-A-L-L. You know, it's retirement communities all over the country. You have places in gyms and resorts, and the thing you're putting into our resort area where we live instead of tennis courts. That's something to think about.
Well, I think anytime you can do any kind of movement, however small it is, it's good for you. It gets the endorphins moving in your brain, which actually make you feel better. So pickleball,
Yeah.
whatever you can.
Just as a, as a step down from tennis, but you can still get a lot of the same activities. It's actually more fun than tennis or something. And another quick thing, I hate to mention an African word, chiropractors, but I see chiropractors who are trained in applied kinesiology, and somebody who knows about that. I just want to throw that out there. There's an Institute of Applied Kinesiology, spelled K-I-N-E-S-I-O-L-O-G-Y. They're trained in muscle testing. They can immediately diagnose and evaluate you, what medications work for you and what don't, and how it affects your body, and all kinds of amazing things that physicians know nothing about. So I just want to throw that out there. If anybody wants to ask questions, I can give more information.
I'm still pretty mobile. Very fortunate. I have IBM. But my doctors told me I can no longer ride a bicycle. And I'd love to go out and ride. But I've been told I can ride a tricycle. And so they have, for all those that do like the bicycle and want a little more safety,
They have adult tricycles. I know there's a company in Florida, and I'm sorry, I do not remember the name of it. The step through is lower. It's actually designed for, well, I think they did it for the retirement community to begin with, but I think it'd be serviceable for the disability community also. And it comes in up to 6 speeds if you don't want just a regular 1-speed bike. So as you get a little bit weaker, you can still ride a bike because it'd be easier to pedal. Other questions?
I have a question that was sent in again, that how can patients and caregivers deal with the extra burdens that add to mental health? Do you have any other resources? We've talked about the phone lines and getting together as groups, doing exercise. Anything else that we're missing that we haven't touched on at this point that would be useful to our...
Well, some other things to consider, especially coming from a state like Minnesota, where soon it'll be dark like all the time, are satellites. Okay, they can be as small as a sheet of paper, smaller, half of that, and they really do work. I can kind of tell when fall really starts kicking in, and I tell my husband, it's time to bring up your satellite. And you can just use it for, he reads it, he puts it on while he's reading the paper. A lot of staff at NAMI live with depression. In the fall, they pull out the satellites, and you'd be amazed at how much it can really help kind of increase your mood a little bit. So kind of also think about something like that. And we also know that things like nutrition, mindfulness, we have 2 apps that I really like. One is called Headspace, and the other is called Calm. And the Calm one is nice because it can be a minute. I'm the first one that focusing for 10 minutes on meditation is not my idea of a good time. But a minute, actually, it can bring your heart rate down when you're starting to feel a little stressed and really work. So definitely check those things out as well.
I think it's also important, I think it's great that you mentioned the shorter days and the darkness and how that will also increase one's chances for depression, but it's really, try to think about what you can do, like indoors if you can't get out. Music can be very healing and soothing. You can do things like adaptive dancing that you might be able to do. If you're able to, a pet, if you can get a cat or a dog. I mean, they require care, especially dogs, but they can be really helpful for people. So anything that you can try to adapt, even if you can't get outdoors, because the weather, when it turns bad, you can talk about sunlight, getting outdoors, all you want, but you're going to be afraid of falling when you go outdoors. So it's important to know what you can do when you're indoors as well.
I just want to confirm the use of a satellite. I have one. I have depression, not related to myositis, but another chronic illness. And my psychiatrist was aware of satellites, and she recommended one from Bed Bath & Beyond that meets the criteria for a satellite will be effective. And you can just order those online. Not that I'm trying to put up that company. It was just that sometimes it's hard when somebody says, "Oh, get this product," and then you think, "Well, where do I go to get it?"
And Amazon has them. There's articles that will tell you I can't remember off the top of my head the exact BTUs and stuff, but you can see what the number is, and then it's pretty easy to find them. There's a person way in the back.
So I have a question
question about this satellite. I'm not quite sure of the mechanics of it, but for those of us with dermatomyositis, I'm wondering if it, in its mimicking of the sun, if it would trigger the DM, and then also related to that, I know at least my therapist always wants me to go out in the sun, and then I'm like, just kidding. So I wonder if there's like ways around that for those of us with DM who know that like vitamin D is really good for mental health and stuff like that.
So I'm not really sure about whether it's UVA and UV lighting. I'm not sure what they're made up of, but I think you can ask your doctor whether that's safe for you. I haven't heard that as an issue because I haven't seen anybody get sunburnt or tanned from these lights. But I could be wrong.
No, I'm saying I was not told that was a problem in the suntan burn. It's just a light that's in a box.
Yes.
It's about a foot and a half tall.
Some are this big.
Yeah, that's right. A little bit bigger.
But check with your doctor.
I check with your doctor on that because it depends on the wavelength of the light and what's coming off of it, and your doctor would know better whether it's appropriate for your skin type or not.
Taking vitamin D supplements, I have one.
This is totally non-technology, but we have relatives in Norway. And in Norway, they have huge numbers of months of total darkness, just like they have huge numbers of months of no darkness at all. And in their winter, they do something, I think they spell it K-O-S-L-I-G, kuslik, and it means basically cozy. And they live their winter working as hard as they can to make life in their homes cozy. They have bright colors, they use candles in their rooms, in their windows. You walk down the streets and you see candlelight in all people's windows and all of that kind of thing. They have bonfires outside, they drink their coffee and have s'mores and sit out in their lawn chairs around the bonfire all winter long in the dark. And they make their hot dogs, they make the most they can of that season, is they make it special. They make something out of it. And then the other thing, just physically, I don't know if it's still only with castor oil. It used to only be castor oil that they would take all winter long. When the kids are in school, they'd have to take their castor oil before they walk out the door. I think there may be like a pill version of that now. But they do that to make up, you know, they make up that dietary or that light difference with that chemical. But they don't. Their whole society has to survive it. So it must work something because it's one of the happiest countries in the world.
Yeah, I've heard about that.
Just be cautious with castor oil. Any kind of oils that you take into your body can end up in your lungs. And if you already have lung problems, please be careful. Yes. So there are other things that you can take that might be better than drinking that castor oil. Well, I thank you all for your attention and the panel for the great presentation that they did to inform us. Please be sure you fill out your evaluations, and these are double-sided. We'd appreciate those of you who can to fill out both sides to give us some good feedback. And we'll be available for just a short bit if anybody has any private things they want to talk about. Thank you.